んにちは、さくらライフセイブアソシエイツ代表の清水直子です。本日は2006年から10年間にわたり、さくらライフセイブの医療パートナーとして日本人の患者様の生殖医療のケースの治療を行ってきていただきましたドクター・ムクジーから卵子凍結のお話を伺います。
Roughly, how many women have frozen their eggs at your clinic?
We've had about 800 cases of women who have frozen their eggs here at RMA of New York. I've worked with Shimizu on about 120 patient consultations.
How old are the patients who freeze their eggs?
We have two distinct ages of women who freeze their eggs. We have younger patients who unfortunately have certain cancers that require them to freeze their eggs before treatment, and they're in their early 20s. Women who choose to freeze their eggs are typically between 30 and 38 years of age, which is the best time to freeze your eggs.
Approximately how many women have returned after fertility preservation to utilize their eggs?
About 10% of those cases have returned to use their eggs. If you're under the age of 38 when you have frozen your eggs, your success rate will be about 50%. If you are 40 years of age when you come to freeze your eggs, your success rate will be closer to about 30. And unfortunately, if you come to us after the age of 42, our success rate is very low. And in fact, we have not had any live births after the age of 42, if that's when you decide to freeze your eggs.
Can you tell us a little bit about the benefits of cryopreservation in the United States?
Well, cryopreservation in the United States has offered numerous benefits to young women. It does two things primarily. One, it allows flexibility on when you can start your family. If you're busy in your early 30s establishing your career, it may not be the optimal time to start your family. Having frozen eggs allows you to put that off for at least a couple of years. The other major benefit is that the stress of finding a partner may be reduced as well, because the biological clock isn't ticking quite as loudly when you have eggs that are frozen and ready for use later on.
What do you think patients need to know about choosing a clinic for egg freezing?
When you choose a clinic for egg freezing, you want to make sure that they have some experience in performing the procedure. You want to investigate their success rates and how long they've been doing it. Our clinic, before we established our egg freezing program, undertook a clinical trial with very young women to see how well this technology worked. The success of that study allowed us to implement egg freezing here in 2003 with some certainty that it would be advantageous to our patients.
How long can a patient freeze their eggs with you?
Once the eggs are frozen, they can be stored indefinitely. There is a storage fee, but biologically speaking, once the eggs are in liquid nitrogen, they can remain in storage for an indefinite period of time.
Can a patient buy donor sperm, and is that practice safe?
The practice of donor sperm has been available in the United States since the early 50s. The practice has numerous safeguards, including infectious disease screening, biological profile of the donors, and in the state of New York, the transmission rate of infectious diseases or other types of diseases is almost zero.
Thank you so much.
ご覧いただきましてありがとうございます。お問い合わせは弊社のホームページからお待ちしております。